Welcome to Employer and Employee Opinions about Workplace Health Promotion Wellness Programs. We're glad you're here. My name is Angie Hunt, Project Manager with the Canadian Institute for the Relief of Pain and Disability, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to CIRPD. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We'll collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all these items when they are available. As I mentioned, my name is Angie and I'll be moderating the webinar and Q&A session. Our presenter today is Kate McCleary. Kate is a Senior Research Assistant at the Institute for Health and Productivity Studies at the Johns Hopkins Bloomberg School of Public Health. She discovered her passion for this field earlier in her career and acquired her education and experience through the lens of worksite wellness by focusing on the quality of work life created by the psychosocial work environment and its impact on organizational and employee health. Kate earned both her bachelor's degree in psychology and her master's of science in health promotion from the University of Delaware. She also holds a certificate in health coaching and is a certified health education specialist. And now I'll turn it over to Kate.
Great. Thank you so much, Angie, for that nice introduction, as well as the opportunity to present today on this topic of employer and employee opinions about workplace health promotion programs. Before we begin and dive into the material, I'd like to just speak about the institute for which I work, the Institute for Health and Productivity Studies. We're a collaboration between the Johns Hopkins Bloomberg School of Public Health as well as Striven Health Analytics, which is now an IBM company. The mission of our institute is to bridge the gap between academia, the business community, and the healthcare policy world by bringing academic resources into policy debates and day-to-day business, as well as bringing health and productivity management issues back into academia. We've got Ron Getzel, who's the senior scientist and director of the institute, who's been widely published, and the rest of our team of 5. These are just a snapshot of some of the publications that we've had in the last 6 months to a year or so. And at IHPS, we conduct empirical research on this relationship between employee health and well-being, healthcare utilization and costs, as well as work-related productivity. So some of these recent papers that we've had come out address things like stock performance of companies that have won wellness awards in the workplace, as well as things like benchmarking surveys, results of the physical activity challenge, cardiovascular disease with the American Heart Association, as well as we've had a chapter in a health promotion in the workplace textbook. So today, I'm hoping that by watching this webinar, you'll have a better idea about the current landscape of workplace health promotion, employee and employer perspectives on these programs, as well as leadership and organizational supports. And then finally, some insights and strategies to improve organizational health and workplace health promotion programs going forward. Now, what are workplace health programs? I'm assuming most of you probably have a decent idea considering you've joined us today, but if not, they're a coordinated and comprehensive set of health promotion and protection strategies, and these are implemented at the worksite, containing programs, policies, benefits, environmental supports, as well as links to surrounding community, and these are all designed to encourage the health and safety of all employees. Now, in the U.S., our health insurance system, it's primarily employer-based, which means that employers are especially motivated to support productivity, employee health, to keep their healthcare spending at manageable levels. And with the majority of adults spending most of their waking hours at work, they're a great opportunity for encouraging healthy behaviors. Now, scientific studies have shown that when these programs are done right, they have positive impacts on the health of employees. They can reduce healthcare costs, increase productivity, as well as even produce a positive return on investment. Studies have suggested that the well-designed wellness programs, when they're well-designed strategies, they typically have a return on investment of $1.50 to $3 for every dollar spent on the program. And these are usually realized closer to a 2 to 9 year timeline. Often these financial returns aren't seen earlier on in the programs, but they take a little while to actually appear. In the U.S., there are also some legal requirements that are worth noting with our programs, such that they must be voluntary, non-discriminatory, be reasonably likely to promote health or prevent disease, as well as protect the confidential health information of their employees, which is very important. Now, these programs have seen a tremendous increase in growth over the past few decades, and most reports generally say that between 80 and 85% of employers now offer these programs. However, as they've become more common, many are ineffective, unfortunately. This can be due to underinvestment, poor design, poor implementation. Basically, some of them also just lack the essential ingredients for effectiveness, which are often referred to as comprehensive programs. And there's this great quote by Henry Albrecht, who's CEO of an online wellness company, Limeade. The way he puts it is simply linking off of your employee portal to your health insurance company's health risk assessment and then assuming you have a wellness program is really missing the point. A successful program requires the support and engagement to go beyond having a program just to say you have a program. So there are distinctions between these one-off program elements, like linking your employee portal, say you have an HRA. It's really not enough. So there's differences between having just a couple of these things and more comprehensive programs. And it's the comprehensive ones that have been shown to be more effective in reducing healthcare costs as well as productivity increases. So we based our discussion mostly around the Healthy People 2010, which is a national framework for health promotion that was developed by the U.S. Department of Health and Human Services, which said that workplace health promotion programs need to include all of these 5 key elements in order to have this comprehensive title. And these 5 are workplace screenings, which are ideally linked to medical care, making sure that people have follow-up treatment if needed. Second is health education, so including things like skill development, lifestyle behavior change, as well as information dissemination and awareness building. Third is a supportive social and physical environment that reflects the organization's expectations of health behaviors that are supported by health promoting policies. Fourth is links to related programs, something like employee assistance programs. And lastly, this integration into the organization structure. Again, not just having one-off program components, but really embracing the whole idea of bringing wellness and health into a workplace setting. Now, the talk today is mostly based on some research that we published in the Journal of Occupational Environmental Medicine earlier this year. And we wanted to find out just how common these comprehensive workplace programs are. So our team, we collaborated with the Transamerica Center for Health Studies, and we're able to take advantage of 2 polls that were done by the Nielsen Group in September 2015. So initially, the inaugural study that was conducted focused more on health insurance and the opinions of employees and employers on healthcare. And that can be found through their website. But we wanted to take it a little bit further, and we were able to embed questions that were more specific to the topic of workplace health promotion programs that went beyond this healthcare and insurance focus. So our research interests for this study we were interested in, obviously, the opinions of both employers and employees, but specifically we wanted to know what employers value and prioritize in their health promotion programming, what they offer, and what they offer to the workers, as well as the extent to which they are comprehensive in that how many and of those 5 components do workplaces have, as well as what proportion of employers did we survey consider themselves offering these truly comprehensive programs. We also wanted to know about what employers thought these programs had as far as impacting certain outcomes concerned with employee health and well-being. And we also were mostly interested in the employees' opinions concerning level of participation as well as just general leadership opinions in their health promotion programs. So a couple details here. The aim of the study was to provide a current picture of the state of workplace health promotion programs in the U.S. from both these perspectives. Our employer group that we surveyed, we targeted individuals who were primary decision makers of employee benefits at their company. So HR coordinator, sometimes CEOs. Meanwhile, the employee survey, we based this on a sample of just the general adult population, but we limited the responses for our purposes to people who said that they were not self-employed, but that they worked full-time or part-time for a company that had 50 or more employees. There are some differences in the ways that laws work in the U.S. concerning employers with less than 50 employees, so we wanted to address the ones that it would be more standardized for. So it is important to note that with this survey and our study, the employees that we speak of, they weren't matched to the employers. It's not like the employee A said that I worked for a certain employer and we looked at their responses accordingly. It was just a general population, but it does, in being independent samples, it does offer a good general picture of opinions of these programs in the United States. So we will begin with the employer perspectives of these programs. So following the Healthy People 2010 requirements, we wanted to know which of these components were offered in employers' workplace health promotion programs, and then what percentage of employers could say they offered all 5. So you can see that the employee screenings with follow-up were most commonly offered, with about 70% of employers saying that they offered them. Health education followed, along with the supportive physical and social environment, about 64%. And then these, I think, more abstract concepts sometimes, the links to employee services, as well as integration into the organization's culture, came in slightly less, around half of employers reported these. And overall, just over 13% of employers that we surveyed said that they offered all 5 elements, meaning that they were comprehensive in nature. Now, this might not seem like a whole lot, but in 2004, the last federally funded survey on this topic was conducted by Lenan and her colleagues, and they found that only 6.9% of employers offered all 5. So while it's an improvement, we've certainly got some work to do. So we also wanted to know more about what employers thought the impact of these programs were on certain outcomes. And the outcomes we were most interested in were workers' health, performance and productivity, as well as healthcare costs. So you can see workers' health as well as performance and productivity came in roughly the same at 83%, saying that employers said that their programs had a positive impact on these components. However, healthcare costs were about 10% less. And this is similar to some of the other research that's out there, and it might be in part because program evaluation is often poor. People have trouble getting claims data and making really solid case for understanding what the impact of these programs on things like costs with healthcare are. But overall, hardly anybody believed that they actually had a negative impact, which is good. The tiny little red sliver was 1.6 believed that they had a negative effect on healthcare costs. So generally, employers are very positive when it comes to the effects that these programs can have on their workforce. Now, in our survey, we found that about 80% of employers said that they offer some sort of wellness program to their employees. Now, I'll take this time to transition over to the employee perspectives, because we were really surprised, actually, by the responses from this group in comparison to the employer perspective. And maybe it'll even surprise you. So if 80% of employers said that they offered wellness programs to their employees, what percentage of employees do you think said that their employer offered them these programs? You would imagine it might be roughly like, it's not what we found though. Only 45% of employees said that they were offered some form of wellness program to them at their workplace. And to us, I mean, if employees aren't aware of the programs that are offered and they don't know how to participate, it really makes you wonder how the programs could possibly be effective. Despite the lack of awareness of these programs, among those that reported that they were offered them, the reception was quite positive, in that more than half reported that they took advantage of the programs and that they participated. So to learn more about what they were offered, of those that knew about them, we wanted to know about the prevalence of certain components that are often found in these programs, the one-off program components, if you will. And we also wanted to know about participation. So you can see here that we found, again, preventative screenings and vaccinations were reported to be the most commonly offered program component by employees, with about 69% saying that they were at least offered the program. And then almost half of people responded that they had participated in the screenings and vaccinations. And oftentimes people highly incentivize this particular program, so it's not that surprising that the participation rate is quite high. We also found other commonly offered program components were things like exercise programs. That could be in the form of on-site facilities or discounts for local gyms. Like 65% of employees said they got those benefits, followed by monitoring health goals, biometrics. Smoking cessation programs were common, and healthy food options was only reported by 50% of employees. But these slides will be given and posted on the website following the lecture, the webinar. So if you want to look at these in more detail, you're welcome to. But on the opposite end of the spectrum, we found that programs that weren't so commonly offered were on-site clinics, case managers, medication adherence programs. Oftentimes this could be because of a cost barrier. Now, in terms of enrollment and participation, other elements that had high participation rates, aside from the preventive screenings and vaccinations, we saw that health risk appraisals, as well as monitoring health goals, these had high rates. About 40% of those employees who were offered them said that they took advantage of them. Meanwhile, the ones with the lowest participation rates were things like smoking cessation or treating substance abuse and mental health, with about 14% of people saying they took advantage of them. And it could be that maybe people feel like they don't associate with those needs, or there could also easily be a stigma associated with participation in these types of programs. Now, reasons for not participating generally, and of course that was just speculation on the earlier programs, but generally the responses were that I'm not interested was the #1 reason. About 17% of employees saying that was their reason for not participating in the program, followed by I'm healthy and don't need to use them, And then also, I already do similar things on my own. And other research, other surveys have found similar responses given as reasons for not participating. Other research, they've suggested that things like lacking time is a big one, or factors like programs being inconveniently located. These are other barriers that people list for not participating. So we wanted to capture employees' opinions about some of the more specific components of the comprehensive programs that are less about what's offered to them in terms of, say, perks or benefits, maybe, and more on this line of organizational support, leadership, things like the overall company culture, program integration, just as well as just their environment. How supportive do they feel that their work environment and people that they work with are of health. So we found that about 72% of employees felt that lower insurance premiums, so an incentive, they felt that these should be offered for participation in their wellness programs. And then following that, 60% believed that employers should play an active role in improving the health of their employees. Meanwhile, we found that fewer than half reported that their leaders were actually committed to the workers' health, safety, and well-being. And if you remember that 64% of the employers said they had this concept of a supportive environment in terms of physical and social environment, only 44% of employees reported the same, that their environment allows them to maintain good health. And these are really just foundational, critical components of being able to feel like you're able to live a healthy, happy life in your work life. You know, are you provided with resources necessary to maintain good health? 42% agreed with that statement. And it really makes you wonder, how realistic is it for workers to be healthy if they don't feel like their workplace supports their health, whether that be managers, leaders, CEOs, or the environment itself in terms of resources. You know, the question becomes, how can we improve these attitudes? And one finding that was included in the published paper that's worth mentioning, a lot of people have questions about what's the difference between small businesses and large businesses. Oftentimes it's not realistic in terms of cost to have these more comprehensive wellness programs. But the one statistical difference that we found when we crunched the numbers was that large employers, employees of large employers, were significantly more likely to report that their employer, this question, provides them with resources to maintain good health, where it was 46% compared to 39% of employees at smaller companies. So it is significant, but generally I think the bigger picture is that it's concerning that less than half of these employees felt that way, that their employer provides them with resources. So it can certainly be improved, and it doesn't necessarily depend on what size company you work for. It's more just that there's some great low-cost ways that are just pretty foundational and fundamental that can be offered with no cost. So the key takeaways here, we found, like many others have, that the majority of employers are now reporting that they offer these wellness programs to their employees, and that between both employers and employees, they've got positive perceptions about them in terms of program impact from the employer perspective, as well as on incentives and the positive thoughts that employers should play a role in the health of employees, as well as showing that more than half of the people who were offered these programs participated in them. But there is still this disconnect between program availability and awareness, and that suggested to us that employers probably aren't doing enough to make these programs visible to their employees if there is this giant gap between program awareness. And then finally, that the employees perceive this lack of support in the work environment as well as leadership certainly leads us to think that there are ways that can and should be implemented to make improvements. So past research on workplace health promotion programs has discovered other differences on topics such as program effects, sources of stress, as well as job satisfaction. And some of these reports offer information that we weren't able to glean from our research, going beyond a little bit to sort of tell a story. So you might have seen this chart recently. It's from the Quantum Workplace and My MAID report that was recently released called Workplace Wellbeing. And it takes that step about the lack of perceived employer support and care for employee health that we found, takes it a step further. And when we consider this slide, if we remember that only 45% of employees agreed with that statement, with the employers caring about their health and well-being, this suggests that if they had felt more supported, those that did were 38% more engaged, 10 times less likely to be hostile, 17% more likely to be working there, recommend their workplace, as well as more likely to go the extra mile for the organization. And a lot of these things aren't ones that can have a cost associated to them. I mean, you can project saying, you know, job turnover, certainly, retention, but concepts like more likely to go the extra mile for the organization, I think there's definitely an element of feeling like, you know, if your employer really genuinely cares about you as a person, your health and well-being, you're certainly going to be more likely to want to help out and do your best for your organization. Now, a Towers-Watson report discovered that far and away the biggest obstacle to changing employee behavior reported by employers is this lack of employee engagement in terms of low participation or interest in programs. And in our experience, these programs that lack a cohesive strategy linked to business priorities, programs that don't reflect employees' concerns or aren't clearly communicated, these certainly won't effectively result in sustainable behavior change or improved health status, which is generally the reason for offering these programs in the first place. And they certainly won't drive down health costs. So even though a lot of employers focus on the incentive component to entice engagement, whether it's carrot or the stick, there's also a lot of really interesting research that's been done using behavioral economics on just how people respond to different forms of incentives. Better engagement could be as simple as improved communication. And when employees know about programs, they do report that they're interested in them, in these benefits. And as we found, over half end up participating. And this will bring us to strategies, because ultimately increasing awareness of these programs and decreasing the gap of those saying that they're offering the programs should be a priority. And most of the strategies I'll touch on in the following slides can all work together to increase the visibility of programs among all members of an organization. And so what really stood out to us in both our research as well as other similar research was this disconnect between employers and employees. Again, it's important to mention and remind you that they weren't matched samples. It wasn't the employees reporting on their particular workplace that were also responding in our employer sample. But the general takeaway was that these two groups have very different perceptions and awarenesses of workplace health promotion efforts as well as their values. And of course, one could teach a whole class on the subject of health promotion programs, theory, best practices, program components. I did a whole master's in it, so it certainly can't be covered in a webinar. But I did want to just bring out a couple of strategies and factors that could make a difference in increasing awareness of available programs, improving the areas in which employees perceive that lack of support, and how employers might think about bridging the gap between them. So if employees are reporting the option to participate in the programs at half the rate of employers that offer them, it really highlights this need to improve strategic communication and communication messaging campaigns. And this is some research that my colleague Karen Kent was lead author on. I believe it was earlier this year or last year. This was published in Journal of Occupational Health and Environmental Medicine. And she found that strategic communications are vital for successfully conveying these culture of health messages, promoting programs, as well as inspiring employees to engage in these activities. And I'm happy to send this report around if anyone wants it to email me. But in more detail, we just picked out here a couple of key actions that can help achieve high reach and increase awareness. So we found that we would advise employers to design their communications campaigns in a way that they're designed around achieving specific, well-defined objectives. These communications ideally would be tailored and targeted to different employee demographics. Different groups have different needs or interests, so it's really important to make sure that you're covering everybody. You know, the millennials, everyone seems to talk about these days and pick on sometimes. Realistically, they generally do have different desires and values than the older generations. It's just one example, but making sure your communications are able to reach, say, using social media, your message is going to be probably different. Making these changes and incorporating them into your strategy is certainly worthwhile. On that note, using different channels of communication, you know, some people might respond to social media and others prefer emails or letters, just different forms to make sure you really reach everybody. It's also really important to make the communication simple, meaningful, and fun, as well as establish a feedback loop where you can determine how well the communications themselves are received. So in many ways, this is what I took to be the most promising element and really spoke to me, that really involving employees by reaching out for their honest input is crucial. I think when you just intuitively think about why is there a big gap between and differences between what employees and employers believe about these programs, as well as a lot of other conditions and factors in the workplace environment, I think it really highlights the need to just have open, transparent communication and start the conversation around health in the workplace and genuinely get feedback from your employees. And this input is really important for refining the program, but it also gives people a sense of ownership. Like when they've been involved in designing a program, what's offered, and they feel like they've had decision-making power in what they're offered, not only will they be aware of the program, but they're more likely to participate, feeling like they've had a say in it. So plenty of different ways to do this, starting with if you are trying to figure out what types of programs employees would appreciate, you can use employee interest surveys. That's a fairly easy way to involve employees. You can identify options of programs that are most appealing, and following from that are probably going to be more likely to be successful in terms of participation. Like I said, all of these things, they demonstrate that the organization really genuinely cares about them and that their opinions matter. But the thing about surveys is what you save in time and effort, you often, on the flip side, lose in terms of insight because they only capture so much. Like for our, for our research that we did, we offered our question choices as preset, you know, select one or all of the following type questions where you check a box. But it really only captures so much. Same with Likert scale. Everyone's been asked is, you know, on a scale of 1 to 5, how much do you agree or disagree with a certain statement? And when you get results from those surveys, although the numbers, it makes it easier to crunch, take an average of how satisfied are you? What are average satisfaction scores of 4 say? Like, what do these really mean? Does it tell you anything specifically? It's true that you can follow them over time. You could say, oh, last year our employee satisfaction in X program was 60%, and this year it's, like a 3 on a scale of 4. And even when the numbers change, it doesn't really tell you the reasons behind the improvement. It can give you a general sense of the sentiment behind what you're measuring, but it really doesn't offer the how or why behind it. And so to take this conversation to really open it up for employees to give their perspective, you can use focus groups. That's one way that you can get a little bit more feedback and offer a more freedom to explain from the employee perspective. Generally, you'd have a facilitator with a group of maybe 6 to 10 individuals, and might last up to an hour or so. But it just gives you an opportunity to hear what employees have to say in a more open setting, as well as feed off each other. Having other people in the room might remind them of something that they also felt was relevant and wanted to share. And they can also learn from each other. So there's some great feedback that can be gathered from these focus groups. The same goes for wellness committees. Some companies are including and putting together these groups that include employees from all levels of the organization. That doesn't do you much good to just have a couple from a small department if you're trying to reach your whole organization. But they can meet regularly and help relay the firsthand accounts of their coworkers from different levels, different situations, just getting perspectives from a wider audience. What people are interested in, they can inform, if there are some ideas on the table, what realistically might not mesh with company culture at one level versus another, and what's feasible. And similarly, these personal connections, just having others to welcome and discuss ideas, they're priceless. And some employees, again, here's a great idea for a low cost or no cost way to open the floor to employees is using wellness champions. You can either recruit them, or True Cultures of Health, it seems that there are a lot of more grassroots efforts. Champions might step forward and offer to help out by just being passionate about health or their well-being. Maybe they've got a good success story or are great at motivating others. And when you find these people, it's important to make sure you've been able to give them resources for them to use in order to help others, as well as just recognize them publicly for the job that they're doing and the leadership role they've taken on in that capacity. And although that's no cost, it might not be realistic for all organizations, but it's worth noting that organizations who had a dedicated employee who their whole job was to promote wellness initiatives, there's research that was saying these situations are able to generate 26% greater participation, which is impressive. And it's probably potentially due to these personnel who are able to better understand the whole culture of the company and how it relates to employees, build relationships with them on the ground. But of course, this is not necessarily cheap in that hiring dedicated personnel is an expensive undertaking, and we would find this more often in being reserved for larger employers. But another way to get around this, or as an alternative, is you can partner with benefits carriers that can take an integrated approach to benefits counseling that can help employees understand the full range of programs that you offer as an employer. And now, I think bottom line here, what it really comes down to in all of these ways involving employees and getting their input is just as a company, as an employer, going that extra mile to make sure that your employees feel like they're heard genuinely, and by starting this dialogue surrounding health and well-being at work. They definitely don't have to be separate ideas. So, as mentioned earlier, we found that employees were open to this idea of using incentives for participation in programs. and our question in particular was surrounding insurance premiums, using lower premiums as an incentive for participation. But in practice, employees should really be asked specifically what motivates them. You can't assume that all employees will welcome that as much as the next option. In our survey, we found 72% would have. But other things you can consider using as incentives could be that your employees are motivated by recognition, paid time off, cash, that's commonly used, prizes, like I said, cheaper insurance, or maybe you've got a wellness event where you promote it with your CEO and a splash tank or something, and employees get the opportunity to dunk them, and just, as an incentive for whatever it is you're trying to encourage them to do, as well as just keeping it fun. But not everyone's motivated by the same thing, and different programs in particular, or different locations, type of employees, incentives could differ for all these people, but the key is just knowing what will work best for your employees. And this last point here, this giving back or social responsibility aspect, there's a really great story I want to share that I heard recently that explores this in action. And it was that the head of HR at Target was telling a story to a panel about how Target incentivized employees, female employees, to get mammograms. And at first they figured, oh, we'll do financial incentives. So they structured it like, get a mammogram, you'll receive a $100 discount on your insurance premium. Then they switched it to get a mammogram and we'll send you a check for the same amount of money, considering behavioral economics in that equation there. But regardless, the financial incentives didn't work. The compliance rate stayed right around 30% no matter what they did. So they decided to have a survey and ask their employees what they wanted to do, and the survey revealed that their employees are really interested in doing more to support charities and the financially disadvantaged. So Target creatively decided to change the incentive to, if you, as a female, get a mammogram, we'll provide another mammogram for free to a financially disadvantaged woman without insurance who otherwise couldn't afford one. So if the compliance rate was around 30% with financial incentives, just ask yourself what you think the difference of incentive made on compliance, because it changed from 30% to over 80%, which, I mean, is just amazing. But it illustrates just that asking what truly motivates your employees and incorporating it into your strategy can have a very significant impact on actual behavior. Along the same lines as incentives, environmental support is just a foundational component of workplace wellness, and making the healthy choice the easy choice is crucial. So going back to the results from our survey, where we found less than half of employees believing that their environment allowed them to maintain health, as well as feeling like their employer gave them resources in order to maintain health. It helps to understand the reasons behind these perceptions. So again, getting employee input, things will likely be different depending on the industry and the setting, whether it's, say, factory workers or a mostly desk-based, say, situation. But the following are just some examples, but of this in action. But say you survey your employees and they tell you that the reason for them believing that their workplace isn't supportive is because of timing or scheduling issues. Say again, I just don't have time to participate in these programs. You might consider offering things like flexible time policies, the option to work at home. You can figure out better times, ideal scheduling for these activities, or another huge one that sometimes people don't take into consideration is encouraging employees to participate by allowing time during the day for them to go take advantage of your supportive environment. Say it's a gym, or stress reduction breaks at work. Alternatively, say employees have an issue with things like the food that's offered in the work cafeteria or nutrition concerns. Some action items could be offering healthier food choices. You can make sure there's a fridge, a microwave, and sink to prepare food so people can bring their own. Or things like hosting an on-site farmers market. We do that at Johns Hopkins, actually, as well as community-supported agriculture. Or a community garden. Really gets the community of workers together. Now, things like if it's not supportive of physical activity, action items might include checking out the condition of your stairwells. Maybe they're not well lit. Do you offer walking paths? Things like encouraging active transportation. There are all kinds of ways and plenty of resources out there to help match what your employees are telling you to the steps that you'll take to encourage it. And of course, it's also largely based on budget. But just making sure to get this first-hand input from your employees can really help steer you in the direction of how employers can help employees feel like their health is being supported at work. Now, regarding this role of employers and employee health, our sample found that they were welcoming employer involvement. And another study, a survey done in 2014 by Aon Hewitt and the National Business Group on Health, which are also both great resources for the subject, they found that employees believed that their employer should give them more practical help in virtually every area as they try and reach health goals. And the employees said that without compromising privacy, they were more willing to allow employers to be engaged in health matters. It's just that they would like the help to be personal and specific. And I think this personal and specific aspect really goes back to, in these communication campaigns and in these wellness programs, it's so important to make sure that these employees feel like they're genuinely heard. You know, it's not just a number on a survey, but really involving them in this decision making. And in ways that managers and leadership can better show their support and meet employees are being visible program advocates. It really doesn't do much good if you put these programs in place and then you don't even connect with them yourself as an employee or a manager. And similarly, just personally engaging in the activities, thereby leading by example. And there's this element of accountability to improving the well-being of employees, which certainly includes providing resources just to encourage workplace well-being within the organization. And this concept of a culture of health is something that has been talked about more and more lately, and really speaks to the integration and linkage components of that comprehensive wellness program, really tying it together and just making it that core assumed culture that people speak of when they think of their company. It requires buy-in at all levels, but this does generally start with leadership at a senior level. With this commitment to health, whether it's through business objectives, strategies, making it really evident that the business itself is supportive of these health goals, really trickles down to the rest of the organization. And likewise, you know, stating it as a business goal, or just making it very clear that organizations care about the people they employ. The people will generally take care of the organization in return. Now, good program planning isn't always the most fun, nor is evaluation, but it's just so crucial. And thinking ahead to think of setting objectives that can be measured. It's often overlooked, and people might just set out to offer programs that seem promising or like great ideas, but without having evaluation built in, when you begin offering them is really missing out on some important feedback, as well as the ability to share successes. But when you set short and long-term objectives, it could be awareness, participation, what have you, just aligning your health program goals within the goals of the business and offering health supporting policies are huge environmental supports that can go towards both evaluation and making it easier to set goals. Like I said, I think one of the nicer aspects of this that makes it especially worthwhile is being able to share your success, which certainly goes back to improving awareness of these programs in the workplace. It's way more fun to be able to talk about these things rather than say, you know, open enrollment is starting. To be able to say, like, hey, like, here's a success story of one individual or a team that we had, or, you know, we had a volunteer day, or, you know, hey, we reached whatever goal it was that you set. Perhaps it's participation in biometrics or whatever. Just being able to share these success stories, whether it's organization-wide, individual level, it can encourage people to engage with the program, both internally and externally, in the sense that it can justify your investment and highlight your commitment to health, and that, like I said, both internally and externally, not only is it encouraging to your workforce that it already exists, things like, say you win a wellness award, a workplace wellness award, being able to promote that and be proud of it, it also gives you the opportunity to attract new talent outside of your organization and bringing them in as potential new employees. So here I've just listed, as we wrap up, some best and promising practice resources that I know I've used quite a bit. And the first one to come to mind as a really great comprehensive tool is this Trans-America Center for Health Studies. We partnered with them to create this employer guide to workplace health promotion that really goes through looking at research and best practices and giving, like, step-by-step how to implement certain components of these comprehensive programs into a variety of different situations. That's a great resource. And then others include the American Heart Association, this Culture of Health Playbook, and then the Workplace Health Research Network that's offered by the Centers for Disease Control and Prevention. And the CDC is also getting ready to launch this fantastic resource that we've been spending quite a bit of time creating that we're really excited about. That's the CDC Workplace Health Resource Center that has evidence-based and credible resources all in this one location, a one-stop shop, as they say, of resources found from all over that are vetted by the CDC, as well as a steering committee of subject matter experts to make sure that they meet certain criteria for being included in the resource center. But I encourage everyone to check it out, whether you're starting a new program, thinking about it, or expanding your own existing, or just looking for new ideas. They've got a search feature, these sidebars that have certain topics you can search by. It's just a great resource to explore if you have particular questions. So thank you, everybody, for the interest in the topic today. I hope that the webinar here has given some insight and information on these opinions about workplace health programs and engaging employees. And between the resources that I've listed for reference, you can also go to our website here where we offer a lot of material that we've published and collaborated on our publications page. But here's my email, KW, or let's see, I know my own email, kmcleary2@jhu.edu. If you have any requests for some of the papers that might not be publicly available, or just any other comments and questions, I'm happy to take them. But I do think we might have some time for opening it up to the audience.
Thanks, Kate. To our audience, if you have any questions, please enter them into the question and answer box on the GoToWebinar panel. So a few questions that came in. Where can we find the link to the research paper that this presentation is based on?
If I didn't include it in the presentation, you can find it through the Institute, the website here, under our publications page.
Okay, I'll also include those in the follow-up, include the link in the follow-up materials for the webinar.
Great.
Is there any single strategy employers use that worked best in bridging the disconnect between employer-employee perceptions?
Ooh, I wish it was simple. We found in the paper that we published last year on strategic communications and building this culture of health that, yeah, with strategic communications that was especially important. But I mean, there's so many elements that all tie in together. Just being a well-integrated program, it's tough to nail down just one.
Okay. And are there any research papers or studies on examples that these strategies have worked before and after?
Yeah, and actually Ron Getzel has published extensively on best practices and some benchmarking studies that can also be found on our publications page.
Okay, I think that's all of our questions for now. Do you have anything else you'd like to add following the webinar?
I don't think so. I mean, I'll certainly add the link to the original paper that I presented on.
Okay.
But that's all from me.
Well, thank you so much for your presentation, Kate.